So 6 weeks ago we placed a couple of implants, one right here, and there's this little soft tissue that makes me think that it might be infected or on the verge of getting infected. If you take a look over here, this side definitely looks like a little fistula that's right in this area. This is not normal, it's not supposed to be there. So I'm thinking that we need to put a healing abutment on there, and I'm hoping the implant underneath is okay. So what we're going to do is, it's already numb on the outside, we're going to put a little more numbing medicine here. Make a tiny incision, just push that tissue back and put a healing abutment on. So first of all, let's start with a little bit more numbing medicine. So you're going to feel just a little pressure here, okay? Make a little incision there, just so I can pull the tissue back and see what's going on. I also want this little distal gone too. So that's got to go. So I'm going to grab one of that little soft tissue piece first of all. Basically the fistula. Oh, Shelby almost got it. Get rid of that. Then I'm just going to gently push this tissue back a little bit. A little pressure here.
My hair just fell out. Just erase that part.
Right on there. Okay, can I have a stir grip driver? Can you see that all right? Where's that curiosity though?
I won't be able to tell you.
The number 9 is missing. Addison, it was missing. Okay, so first thing I want to do. Sounds really solid. No mobility. That's all good. So now I'm going to use a piece of gauze as a safety net because these pieces are small. Just a regular one will be fine. Just to make sure that you don't swallow anything. This driver goes on, and I should be able to back the cover screw right off. Okay, take that off. Go ahead and touch it right down there for me. Can I have an Explorer? Gotta make sure there's no soft tissue encapsulation or anything around this thing. Stings a little bit in there. Yeah, there's a pocket in there, isn't there? Alright, so what that means, Addie, is that I gotta take this implant out. Yes. Have it available just in case it's gonna work. So just a little pushing and pressure here, okay?
Do you want me to come to the other side of things?
What's that? So a little pressure here. Let's see what's going on underneath here with this one.
Do you need the other side or yes?
We don't have apologize. Okay. Yeah.
Yeah, I did do it.
Just pressure, right, Dad? Okay. Now what I'm making sure is that there is trouble in this one too. Look at that. Look at the soft tissue moat that's around that thing. Like, look at that right there. There's a little soft tissue moat around that thing. So it has to go too. See that?
No, that one has
It does, unfortunately. So we're probably not going to be able to place the implants at the same time. Open nice and big.
Just waving at you. Stick my hand out and wave at you.
Well, that kind of sucks, Daddy.
I got it.
Yeah, both of these implants are not doing it. Probably just half a CC. Okay, Addie, what I'm going to do is I'm going to put this on this one. It's going to click. Okay?
Lean back in or just let it heal?
Just let it heal.
On both sides.
Come back another day, yeah. Okay, longer driver. Open nice and big, Ed. You got to stay open bigger, okay? What I'm do is I'm going to like back this thing out. Open nice and big for me. There you go. You hear how that clicks on? Okay. Take a nice deep breath. It's just going to sound weird. Open really big. Okay. It's going to sound weird. You okay? This side is basically done. So this side was good and numb. It didn't need any. Open big. Open really big. So there's that implant. Let's get it clear out. Yeah. So pull this back. Push it right in there. So now I want to get all this soft tissue envelope removed in here. Encapsulation. It's better to know now though and let it sit. Section right in there.
I think you're gonna get a tooth on there.
Yeah, look at that. There's just a lot of soft tissue encapsulation all the way around that.
Can I get you anything else? I'm gonna do the logs right here, but.
Good riddance to that, Addie. That would have been a problem and it would have made things more complicated. So I'm glad we discovered this now. You're not, but you should be overall. Okay, Kelly. So make sure all that soft tissue's out of there. Irrigation. This is not sore, right, Addie? Your hand's going to be sore if you keep digging in like that.
That's what I do every day.
Yeah, just the whole time.
Yeah.
All
I
right.
don't always dig in, but I do.
Okay, let's fill that in. So we're almost done on this side, Addie. Can you feel the other side getting more numb? Can you feel the other side getting numb? Yeah,
I guess.
it got more numb, your lip. Got a little bit more bone grafting material. Now this stuff is very granular. It's got the look and feel of sand. I promise it's not sand, but it's bone grafting material. I'm overfilling it so there'll be extra in here, okay? I know it's a lot of pushing, isn't it? So I'm just filling and stuffing that in and making sure that when we come back we have lots to work with. Like that. Okay, now.
Just one. Yeah, okay.
Yep. Yeah, lost it.
But the other one is coming out as well.
Yes.
Yes.
It's just not there yet.
I got you. I was like, did I lose it?
But one on each side.
We're gonna do this so that they can see.
How about
Were you able to see or able to take it out with your teeth?
so just pressure, right, Dad?
Yeah, hands are.
Just pressure, right?
Kinda.
So this little die, you're able to take it out with that?
Yeah.
Yeah. Open nice and big for me, and I'll need the hand wrench. So this clicks on like that. Then we need to undo it. Open nice and big. Open. Didn't really put up as much resistance at all.
Yeah, I'll be fine.
What's the matter?
Or
Just
tongue tickle your hand.
here. Laughing I'll take giggling and laughing. So the implant's gone, Addie. So now what I'm doing is making sure it's nice and clean. Just pressure, right?
Feels weird.
It does. Open nice and big for me.
Kinda hurt.
Open nice and big. Yeah, irrigation. Hold on. Okay. With some bone grafting material and then you're done. Yay, right? The nice thing about getting after it now is that we're going to have lots of bone to work with here in the end. Even though this is a nuisance right now. 8 to 10 weeks we can get a couple new implants in there.
Do you want a periosteal?
No, this is perfect. It's such a small little area. Weird, huh? Okay, that's full. Let's get one stitch. And then she needs 5 days of antibiotics too, please. If you want, just call it into Liberty Lake Yolks and I can go pick it up.
What would you like to want?
Yeah, some amoxicillin 875 BID. Do you have some Paradex still, Addie? Prescription mouth rinse.
% overall drop in opioid use, and with the proper understanding and use of Exparel, You too can see the success that Exparel will bring to your clinic. Dr. McClelland, DDS, has been using it in his clinic for a few years now, and he's seen great success in his patients and their pain management every day. In this 6-video series, you get a professional masterclass that will give you the jump start you need to include Exparel in your daily routine. It includes a bonus PDF with a patient information handout, post-op medical instructions, and a quick look sheet for the materials and supplies for explaining Exparel. Go to teachable.com today and get educated on a non-opioid anesthetic that will help your patients have a better day.